I wanted to jump on here, do a quick update. Today I did hit 6 weeks to be exact. Every Monday I hit a different week, which means next Monday I'll be 7 weeks or whatever. But yes, I hit 6 weeks today, and I had to call out of work today because I had another episode of the vaginal I don't know if I should call it vaginal bleeding or vaginal spotting or whatever, but I'm on my way to the ED or whatever. I tried to call the advice nurse of where my OBGYN is, but I misplaced the number. So the 24-hour number that I called, they just basically took my information and took my wrote my charted my symptoms down, and just told me that someone will be reaching out to me in a couple of hours. But I don't have a couple of hours, y'all. Like, my anxiety is like so freaking high right now. So they told me if I'm having, the bleeding, the spotting, or severe cramping, feeling dizzy or anything like that, just to basically go to the emergency room. So that's what I'm getting ready to do. I don't feel dizzy. I don't feel lightheaded. I'm not cramping. I did have a really sharp cramp last night on my right side when I had got done using a bathroom, and then it like went away. It happened. It was like it was like 3 to 5 minutes or whatever. So yeah, y'all, like, my anxiety is like, the first trimester is so freaking draining. Like, it's so freaking draining. Y'all do not understand. Like, if you've been pregnant before, you know exactly what I mean. If you are a mom and you had pregnancy scares in your first trimester, you know exactly what I mean or whatever. So yes, y'all, I'm about to go ahead and head to the ER or whatever, and see what they say. Hopefully they can give me like an ultrasound or something like that, just to give me some type of reassurance that the baby is okay or whatever. Because it's like, even so early on like this, I'm only 6 weeks, you gain an attachment like already, it's freaking crazy. Whatever. But yes, y'all, I'm so freaking tired. Like, I just want this first 13 to 12 weeks to hurry up and fly by. That way my miscarriage, chances can decrease or whatever. But we're on our way to the ER, and I'm gonna take you guys along with me. We're gonna find out exactly what's going on today, if they're able to even tell me anything. Y'all, my hair itch so bad. I'm so ready to take this out of my head. But all right, y'all, come on, let's go. Okay, y'all, so I'm just getting home from the emergency department. Well, I'm not gonna say just getting home. I've been home for like the past couple of hours or whatever, but I've been sleeping. I was like so freaking tired. I was in the ED from like 7 this morning up until 12 o'clock noon or whatever. So quick update. They did a transvaginal ultrasound, and they also checked my HCG levels, and my HCG levels was like 14,903 or something like that. So my HCG levels were basically normal. They were perfect, averaging out to basically the amount of weeks that I'm supposed to be. I told you guys that I was like, based off of the app, like the period apps and the pregnancy apps, which ain't always accurate. Aren't always accurate. But the period app was giving me 6 weeks today, and I told y'all every Monday I hit a different week. So next Monday I would have been 7 weeks. But when they did the transvaginal ultrasound or whatever, it was basically them telling me that I was 5 weeks and 4 days. So I was like the app was like 2 or 3 days off, and they was basically doing the measurement off of the gestational SAC that they saw. So because I am still early, they don't really start seeing anything until you're like 6.5, 7 to 8 weeks. Even sometimes they don't see anything until you're like 7 or 8 weeks. There was no yolk sac as of yet, and there was no fetal pole, but they did see a gestational sac. So I do go get my HCG levels redone. I want to say 2 days from today. I have to follow up with my OB, and they will put the orders in for me at LabCorp to make sure my levels are doubling. Or they told me I can go back to the ED and they'll do it. And you know, with the emergency department, you basically get your results right then and there or whatever. So I'm not for sure exactly what I want to do, but it did put my mind at ease due to the fact that my HCG levels are really, really, really high. They did see a gestational sac. Maybe like within another week and a half to 2 weeks, that may be when they're able to see the yolk sac. And then of course around 7.5 to 8 weeks is when we supposed to see like a fetal pole with a little heart flickering or whatever, y'all. But yes, I wanted to come on here and just give you guys a quick update because I wasn't feeling good today, y'all. Like my mind was like all over the place, and I don't know. I don't want to say I'm like down and depressed, but I really do not feel like myself because anytime there's like a pregnancy and there's spotting involved, it's just like a red flag because there's not supposed to be any type of spotting during pregnancy. However, it's honestly, the spotting in pregnancy is pretty common or whatever, and I've learned that by working in the OBGYN clinic. You know, it's a lot of different reasons of why women can spot during early pregnancy, and the pregnancy turns out, you know, just fine or whatever. But a quick rundown: the emergency room was horrible. It was really, really crowded in there. I'm not really a fan of wearing masks anymore, like the face coverings, but because it was so much going on in that ED, I did cover up with 2 masks around my mouth. And I want to say they was moving fairly fast. However, I did go in around the time when there was a shift, when there was shift change, so that did prolong me being triaged and stuff like that or whatever. And when they triaged me and they did my vitals and stuff, they set me back out there in the waiting area, and they maybe like 30 to 45 minutes later, they called me in the back to do my ultrasound. And then when they did my ultrasound, the lady that was on my ultrasound, she wasn't really giving me any information like as she was doing the ultrasound. Like she was so freaking quiet, y'all. And it was like really bothering my freaking brain. I'm like, lady, if you don't talk to me, say something. She was just so quiet and just clicking away. She did a transvaginal, of course, because you can't see nothing when you do the abdominal ultrasound so early. So she was just clicking. So I asked her, I was like, you know, can I see? Like, and she was like, something about something, but she said in a second, or I forgot what she said, y'all. I don't even really know because I was falling asleep, honestly. That's how tired I was or whatever. Because mind you, last night before this morning when I went to the ED, I woke up like at 3 in the morning and I seen another episode of the spotting. So that just kept me up like pretty much throughout the rest of the night. So I was like really, really tired. But yes, she wasn't really saying but so much. I'm going to insert a clip right here to show you guys exactly what went on in there.
Did you give blood work here?
Yeah. No, here? No, not yet. Can I see?
It might be a little early. So we'll see. The lab work. That's your ovaries, the right ovary.
So yes, it was like, girl, you not saying nothing to me. You not talking. You not giving me no reassurance. But because that is an emergency department, it's not like, you know, labor and delivery or OBGYN or midwives or anything like that. I'm pretty sure they're not like really specialized in giving information. You know, her job was probably just to do an ultrasound, take some imaging, and send it over to the doctor. And that's exactly what she did or whatever. So yes, y'all. And then after that, they set me back in the waiting room. And then they called me back. They called me back in the waiting. Well, I'm sorry. After that, they sent me in the waiting room. And after they sent me in the waiting room, they called me in the back again, maybe like another 30 to 45 minutes later. And when they called me back that time is when they was doing my blood work. And they was going to put an IV in my arm. And I was like, what do I need an IV for? And they was like, you know, well, the IV, the fluids, and the saline, it basically helps with, you know, prenatal cramping, XYZ. And I was like, yeah, I'm one of them people that do refuse certain care. So it's just like, then why are you here? Or whatever. But I was like, you know, I don't want the IV. I don't want an IV. I'm fine with you guys taking my urine catch. I'm fine with you guys sticking me, drawing blood. I'm fine with the transvaginal ultrasound, but I don't want an IV. I'm not dehydrated. I'm just fine or whatever. So we had a little back and forth with that or whatever. But then they was like, you know, well, you can, I guess after I told them, I was like, well, you know, I work in the ED as well. So I thought normally that, you know, IV fluids are basically for someone that's, you know, kind of dehydrated or whatever. Not knowing when she explained to me it's for other reasons as well. But I guess once I said that, she was like, oh, well, you know, it's up to you. You can refuse it. So I was like, yeah, I don't want the IV fluid. You know, if you need me to pee in a cup, just give me some water and I'll pee or whatever. So that's what we did with that. They never gave me water. They never gave me water to pee. I ended up peeing on my own, but they did draw my blood to, like I said, to check for my HCG levels, to make sure my levels were matching up to where my weeks were basically they took my HCG levels to make sure the levels were matching with the amount of weeks that I'm supposed to be. And it's given, which did she say, 5 weeks and 4 days. At first she told me 5 weeks and 2 days. Or whatever, and then she came back and was like, oh no, I'm sorry, you know, I told you 5 weeks and 2 days, but I did see that it was like 5 weeks and 4 days or whatever. So yes, y'all, I gotta follow up in 2 days to get my levels drawn again. It's just very like mind-boggling because I've been on YouTube, I've been Googling, and you know they always say stay off of Google, stay off of just stop it. But I've been on Google, y'all. I've been on YouTube watching videos of just so many like threatened miscarriages, what they call them sometime in the hospital, threatened abortions and signs of miscarriages and symptoms and all kinds of crazy stuff. But they weren't really too concerned today with me. It was just basically saying, you know, oh, it could have been implantation bleeding because of how early along you are or whatever. So yes, y'all, I do not know, like it's just like I want to like be like I'm not gonna lie to y'all, I'm like extremely freaking excited. Like I'm so freaking excited, but at the same time I'm just so worried and so scared because it's just like the spotting, you know, the first trimester can be very scary. So they did recommend pelvic rest, so nothing in the vagina, no heavy lifting. I do have to stay off of work for the rest of the week. They did want me resting. And like you guys already know, my first OB appointment is the 15th of January. And it feels so freaking far away, y'all. Like it feels so freaking far away. But I had this same spotting with my daughter. I had the same exact spotting I'm experiencing now. I had it with my daughter. And I spotted with my daughter up until I was 3 months pregnant. But they were constantly checking my HCG levels. The OB that I have right now, they're not doing that. Like me getting my HCG levels checked in a couple of days, that's the order from the emergency department today, telling me that they want me to go get that done. When I spoke with my OB over the past couple of days, I spoke to them twice. I spoke to them today, this morning, and I spoke to them last week. they're not interested in just, they're not, basically what I'm saying, they're not interested in me getting my HCG levels checked every 48 hours. But I'm like, why? Like, I thought that was like one of the first things that you guys do when someone is spotting an early pregnancy, to determine that no miscarriage is happening. You want to check their HCG levels, because I work at an OB clinic, and that's the first thing my providers do when someone come in for vaginal spotting. Oh, you going to that lab and you're getting them HCG levels checked, because baby girl, them levels can drop just like that. You can have a miscarriage and not. So yes, y'all, I know my mama picked this baby out, especially for me or whatever, the little garden they have up in heaven. So I'm not gonna worry, but like I said, it's very scary. It's very scary. I don't have any cramping. I'm not lightheaded. I'm not dizzy. I'm not, saturating pads, back to back. Like, I don't even have a pad on. I've been wearing panty liners. And then when I use the bathroom and look at my panty liner, there's nothing on the panty liner. You only see the brown discharge spotting or whatever when I wipe. And then also they asked about like STIs and STDs and stuff like that. She was like, well, that could be another leading cause of vaginal bleeding and spotting, STIs or STDs. So if you are, I didn't know there was a difference between the two, y'all. I ain't even gonna lie to y'all. I thought that shit was the same, but it's definitely different. I learned that working in an OB clinic as well, or whatever. But she was like, if you're worried about anything like that, we could definitely do some tests. And I was like, girl, I ain't got nothing to worry about when it comes to that at all. I was just tested like a month or two ago, and then on top of that, I ain't out here catching bodies. So baby, you ain't gotta worry about it. Definitely ain't gotta worry about it or whatever. So yes, y'all, I'm gonna try to keep updating y'all like constantly, like as the pregnancy progresses and I go to my appointments, and I'm just trying to like get some encouraging words like from y'all. Like, I know y'all be having to help me out, because I know when I did my BBL vlog and I had my surgery, like y'all came through. Y'all definitely came through for me. I came through for y'all. Y'all was DMing me on Instagram, inboxing me on Facebook. Like, I got so many surgery sisters, it's not even funny or whatever. But yes, y'all, I ain't even get no pictures. Like, she didn't even give me no picture. I know the picture is not gonna show nothing but an empty gestational sac. But you could have still gave me a picture, sis. Like, why you being stingy? But like, that's my baby. Like, it's not yours. Or whatever. But yes, y'all. So I do feel a little bit better. A little bit better. We've seen a gestational sac. We're just waiting for the yolk sac. And like I said, that should develop over the next week and a half. Y'all would be surprised of how fast pregnancy progresses. Like over the what am I trying to say? I know I'm slow. I always got to do like a pause in the middle of talking and try to think about what I'm trying to get out to y'all. But excuse me, pregnancy definitely progresses over the weeks. So you'll be surprised of how much the baby has grown, like from today, which is Tuesday the 30th. I told y'all the 31st earlier. Definitely not the 31st. It's the 30th or whatever. But yeah, today the 30th. You'll be surprised of how much the baby's grown from today the 30th up until next week, Tuesday. Like, that's the week's difference. They grow so freaking fast. Just like when they're outside of the womb. You have how many weeks of the newborn stage, and the little newborn scrunch, when they scrunch their little butts up when you pick them up, that doesn't last long. So same way with pregnancy, they grow so freaking fast or whatever. But yes, y'all, I want to come on here and give y'all a quick update. I know a couple of y'all reached out to me on Facebook as well and was like, have you checked on the baby yet? And I was like, y'all, I have not checked on the baby yet, because I don't want to check on the baby yet. Like, I'm trying to wait it out because I'm not trying to wreck my freaking brain. But when I had that second episode today of the spotting, I was like, pew, we gotta go. Let's go to the ED and see what's going on and whatever. But I feel better. I feel a little bit better, but that ultrasound was just giving me more anxiety, because sis wasn't saying a word. Like, she was not saying a word to me, and it was pissing me off or whatever. She would just click, 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 or whatever. And that's just a future reference as well. Like, y'all, them pregnancy apps, them period apps, they will not always be right, because I'm going off of me being 6 weeks. Gestational SAC measured 5 weeks in a couple days. So yeah, but all right, y'all, I see y'all in my next video, probably like in a couple of days, because I'm gonna update y'all on my HCG levels when I go get them done 2 days from today. All right.